Welcome to Shri Medical College. Today we will explore a day in the life of a medical laboratory technologist. A patient's care would not be possible without the work of medical laboratory technologists. They aid doctors in making diagnoses and treatments by examining tissue and fluid samples taken from patients. How does a normal day go for a medical laboratory technologist? Have you ever wondered who looks at your blood, tissue, or other samples after you send them to the lab for your yearly checkup or diagnostic test? The work of medical laboratory technicians is crucial to the care of both patients and medical professionals. Perhaps you haven't heard much about medical laboratory techs and are curious about a typical workday in this field. Those who work in medical laboratories can find employment in a variety of settings, including hospitals, medical offices, nursing homes, urgent care centers, and primary care clinics. You have a lot of leeway in terms of where you can work in this sector. Medical diagnosis relies heavily on the work of medical laboratory technologists like yourself. Laboratory technicians perform diagnostic tests to identify diseases and conditions like cancer, infections, and immune system dysfunctions. Workday tasks may include patient blood draws, marker testing, solution preparation, sample examination for disease or malfunction, data recording, and blood type analysis to find the transfusion match. In the course of your day, you will also be responsible for checking the accuracy of patient records and the labeling of lab specimens. In this role, you may be responsible for sterilizing and maintaining a variety of laboratory and diagnostic instruments, including microscopes, spectrophotometers, and more. It's likely that you'll have to discuss a patient's test results with other doctors and nurses face-to-face. Technologists in the medical laboratory field work in a wide variety of settings, including general hospitals, outpatient clinics, research labs, nursing homes, and specialized clinics. The job market for medical laboratory technicians is highly mobile. The information they provide is vital to the treatment decisions made by your doctor and care team. Medical laboratory technologists perform chemical, hematological, immunologic, microscopic and microbiological tests on blood, urine, sputum, feces, CSF, peritoneal, pericardial, and synovial fluids. Clinical laboratories at hospitals, reference labs, biotech labs, and non-clinical industrial labs are only some of the places where medical laboratory scientists are employed. Medical technologists bridge the gap between the hard science of medicine and the interpersonal dynamics and clinical decisions that arise between patients and their primary care physicians. Medical technicians may operate behind the scenes, but their contributions to patient care are crucial in ensuring that patients and their families receive excellent treatment. Scientific inquiry and evidence-based patient care find common ground in a medical technologist's daily work. Medical technologists perform essential diagnostic tests to diagnose dangerous disorders like HIV/AIDS, some cancers, diabetes, and other long-term illnesses and select the best treatment. Medical technologists may also perform prenatal blood tests to evaluate the health of the mother and fetus, as well as any potential hazards to either. Medical technologists are responsible for a wide range of diagnostic procedures, including complete blood counts, liver function tests, renal function tests, and phlebotomy. To sum up, A medical technologist is usually involved when more investigation is required and tests are ordered on patient samples. Medical technologists conduct a wide variety of tasks, including but not limited to complicated chemical, biological, hematological, immunologic, microscopic, and bacteriological studies. Medical technologists analyze blood, urine, and tissue samples for transfusions to evaluate cell count, cell shape, blood group, blood type, and blood type compatibility. Medical technologists consult with doctors about test findings and other medical procedures and work in many intriguing and challenging healthcare jobs. The benefits of becoming a medical technologist extend far beyond the mind-expanding nature of the work itself. Medical research facilities in the present day are constantly improving their diagnostic capabilities by incorporating cutting-edge technologies. Since more and more fields of study utilize specialized research and high-tech computerized equipment in laboratories, the number of lab specializations continues to expand. Medical technologists' clinical research has led to innumerable medical breakthroughs and advances in countless subspecialties. Those working in the field of medical technology, in particular, are held to a higher standard of problem-solving ability. Lab technologists must pay close attention to detail as well, as even seemingly insignificant variations in test components or numerical readouts can have a significant impact on a patient's diagnosis. Due to the prevalence of automated lab equipment, the ability to use a computer is essential in addition to the aforementioned manual dexterity and adequate color vision. Lab-good analytical abilities might be useful for technicians because of the frequency with which they must deal with large datasets and various samples, search for pattern in the data, and write reports. Issues like pollution, injuries, or a contagious atmosphere can be overcome with the use of problem-solving abilities. If you have great communication abilities, you'll be less likely to make mistakes or misinterpret information while reporting. Technicians with strong organizational skills will find working with several samples easier. They are important to have so that data like test results may be sent out as smoothly and quickly as possible. Testing and a definitive diagnosis are prerequisites for any kind of medical treatment. The function of medical lab technicians is vital since it is on the basis of these test findings that doctors recommend courses of therapy or perform procedures as necessary for the patient. Without their work, doctors would not be able to move further with treatment. It is not enough for a medical laboratory technologist to have a broad understanding of the field of medicine and health, they must also be technologically savvy and up to date. After 12th class, students may consider enrolling in Shri Medical College's B.VoC Medical Laboratory Technology program. If you're interested in the medical field but don't want to go through the rigors of an MBBS program, studying to become a lab technician is an option. Graduates of the program will be prepared to diagnose, treat, and prevent disease. There is a growing need for lab technicians that are proficient in using medical equipment, conducting diagnostic tests, and other lab-related tasks. During COVID-19, the lab technician program expanded its popularity beyond what it had been during the pre-medical era. Medical laboratory science, the subject of the lab tech program, focuses on the use of clinical laboratory investigations in the diagnosis of disease. Accurate clinical investigation and laboratory report writing are impossible without a correct diagnosis. B.VoC in Medical Laboratory Technology Eligibility Criteria. 12th class from any recognized board. Students, arts, commerce, science, of any age can apply. A minimum score of 50% in the 12th class. Join Shri Medical College and take the first step toward a successful career in medical laboratory technology. We are here to assist you in launching your career as a medical lab technician. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.